All right. Good morning and welcome back into this episode of The Child Voice. And I am super excited today because we have a very special guest joining us today, Valerie Tan. And Valerie is currently doing a fellowship. I guess we're calling it that. Yeah, fellowship. She's a fellow with us through YSEALI, but I'm going to let her talk about that here a little bit more. But yeah, convinced Valerie to do just a podcast episode with me that we could share out with advocates, just kind of picking her brain about a little bit about what it looks like on her end. So thank you, Valerie, very much for joining me. I appreciate it.
Thank you so much, Carrie, for having me. It's an honor. Yeah.
Yeah. So Valerie, if we could just get started, like tell us, so
hmm
you are a therapist in Malaysia.
Yeah.
If you can kind of just tell us like what drew you to the field of being a therapist, what made you decide, oh, I want to go into that world?
Yeah. So, funnily enough, it was actually through volunteering. I was volunteering a couple of years back before doing my master's in counseling. I did a volunteering stint with um a NGO or a nonprofit organization that works with the community mental health field. And I wanted to put myself, I wanted to experience or explore what's it like to work in mental health. And that's why I decided to volunteer for a bit to just see what's it like. And because of my time there, I was really inspired by the people that I worked with and being able to talk to various people about the work that we can do in Malaysia, and that really made me want to pursue being a therapist. And it was since then that I decided, yeah, I'm going to go for my master's, and here I am now, yeah, being a therapist and working with community clients as well as clients in Malaysia. Yeah.
So just out of curiosity, so
Mm.
what were you previously going to school for? Like what was your initial path or plan?
So my background is also in
Okay.
psychology and cognitive neuroscience. But when I graduated, I worked as a special needs educator for a bit, for about 4 years or so. And since then, decided to go into the mental health field and work as
Okay.
a therapist.
Okay. So still very much related, just kind of a little bit of yeah, path difference there.
Diverted,
So
yeah,
yeah,
yeah.
I love that. I love that. So kind of briefly, I would love to just hear and be curious about what does the mental health landscape look like in Malaysia right now? Is it similar to what we're seeing here? Is it very different? I would just love to
Mhm.
hear what does that look like in Malaysia?
I think in Malaysia, we notice that there is an increasing need, especially after COVID, and stigma is still pretty high, back in Malaysia. But I would say after COVID happened, people are becoming more aware of the importance of mental health.
Hmm.
And we are also noticing some similar trends in Malaysia where the impact is mostly on children and adolescents, as well as families and relationships in general. Yeah.
Interesting.
Mhm.
So so really COVID kind of really brought it out as far
Yeah.
as like mental health and I'm guessing probably just
hmm
that social isolation piece, I'm guessing.
Yeah.
Um, are you seeing or I guess do you see like coexisting where you have the substance use and the mental health? Is it primarily mental health or are you also seeing a lot of substance use disorder?
We don't have, there are a couple of substance use, but not as much as we would see here.
Okay.
Um, we do see more cases of domestic violence
Mm,
and child abuse and neglect, yeah.
okay.
But not so much of substance use as much, yeah.
Okay.
So I would say that's probably the slight difference that we see back home in Malaysia, yeah.
Interesting. So kind
Mm.
of going back to that mental health piece just a little bit, is it mainly depression? Is it anxiety? Is it trauma? Or is it kind of just all of the above?
Yeah, I think it's all of the above, as you mentioned, a lot of depression, anxiety, just socially isolated, right? And we also see a lot of families that are impacted by trauma, a lot of suicidal ideation as well. And yeah, just all of the above, basically.
Okay.
Yeah.
Yeah. That at the really at the heart and the root of who we are as humans, we all struggle with the same thing.
Yeah, yeah,
Yeah, that
yeah.
mental health piece is so big. So,
Mhm,
one of the things that I know that we've previously that you've kind of mentioned before in our
mhm,
conversations is this whole idea, this model of a task sharing approach. This is
mhm.
kind of a new term for me. I don't know that I've ever heard that term or used that term.
Right.
So, can you
Mhm.
explain what is a task sharing approach? What does that look like? What does that mean?
Right. Yeah. So in my work back home, with the community work that we do with the community members, we try to train them using this task sharing approach method, where we basically shift the task or share this task with non-specialists, basically just normal people like who are not trained specifically in a particular area, to basically share the load to manage um care, right? To manage high demand cares that maybe like support more peer supporters and more lay counseling kind of people, something like that. So to manage these areas to improve access to services, particularly in settings that it's hard to get such services, right? To get mental health services or to get maybe even legal support and things like that. So the goal is to train non-specialists to be able to have some form of skills to provide that support to their community. Yeah.
Interesting. So kind of like a wraparound model, but
Yes.
with a wraparound model, you do have a lot of professionals, but it sounds like in this kind of this wraparound model, it's professionals, but it's also not professionals.
Yes. Yeah.
I love that.
Exactly. Yeah.
Are these professionals, I mean, are they usually connected with the family somehow, or are they not connected with the family?
So, when I say that these non-professionals that they are trained in doing this task sharing approach, they're usually more connected with the people in the community. So that gives us easier access to reach out to those who are in need. But from our side, the professionals like the mental health therapist or like people who have specialty in different areas, we oversee or like we supervise these non-specialist people, but we train them and we ensure that they are competent enough to provide the support. It's very similar to what you're doing at CASA with the advocates, right? You train these volunteers and you sort of maintain, like, you have a peer coordinator and you like do check-ins with them monthly. So I would say that in itself is a task sharing approach because you are empowering people in the community itself to help share that load of work when maybe the professionals themselves are probably overloaded with other
Yeah.
cases and tasks, yeah, at hand. Yeah.
I love that. I love the whole idea of the community like stepping up and wrapping around these
Mm-hmm.
families, right? And so
Yeah.
so can you give me like a couple of examples of maybe some of these community mental, some of these community folks that you oversee or
Mm-hmm.
work with? Like,
Mm-hmm.
can you give me just a couple of examples of maybe what they would be trained in or what they would be supporting the family with?
Yeah, sure. So, for example, we have a program that trains adults or mostly mothers, right, from the community. So we identify a couple of potential mothers who we see has the potential to provide peer support or sort of be that champion in their community. And we train them over 3 levels. So we have a basic level, advanced level, and the third level we call the ambassador level, or very similar to an advocate, right? And they go through each of this level. They have to go through the basic, and once they graduate, they go to the next phase, and once they pass the advanced level, then they become an ambassador. Um, and the whole idea is to train these people to become the pillar of support within the community itself. And they are also the point reference for the community members to go to them whenever they need some sort of help or support or resource. And because the barrier to, I think there's a lot of barrier to seeking for mental health support. And because the stigma is still relatively high, a lot of people are not aware as well, right, of what support is needed and things like that. But when we have people, or we have ambassadors within the community itself who are trained and supported by us, they then also, it's easier for them because it's someone they know within the community, and it makes it easier for them to just get support or just even share, right? Share their concerns or yeah, whatever they're going through with that person in the support instead of expecting them to come to a therapy session. Because sometimes it's just difficult and the cost of therapy is high as well. It's not cheap, right, to access therapy in Malaysia. So by doing this, we actually are bridging the gap and we are actually meeting people at where they are, by training people within the community itself.
I love this model. I love just
Mm-hmm.
again, you're empowering other folks in the community to step up and be
Yeah.
that peer support. And then, like you said, you're breaking down some of those barriers
Mm-hmm.
for families, whether it's cost or just comfort level or even just wait lists, right? That,
Yeah.
that if there's a wait list, but I can connect you with this, mental
Mm-hmm.
health advocate,
Mm-hmm.
here in your community, and then kind of
Mm-hmm.
just building that their own little community, right? I think that's
Yeah.
very much a prevention, or I've talked about kind of that strengthening family piece
Yeah.
that we need social connections, we need those concrete supports in our life, those people to
Absolutely. Yeah.
ask those questions to or to get that support. So
Mm-hmm.
absolutely love that.
Mm-hmm.
Um, so so it sounds like it's a pretty successful program for you guys then,
Mm-hmm.
right? I mean, do
Yeah.
you know, and this is like I didn't prep you for this question at all, but like, do you know, like, off the top of your head, like, about how many of these mental health advocates, like these community folks that you have?
Yes. So in total, we have now about 60 over advocates or ambassadors, we call them. And they comprise of both adults and youths. So we have youth ambassadors as well. Yeah. And it's very nice to see how both adults and youth can work together, to run programs and facilitate programs even as part of their training, and yeah, empowering them to um, do initiatives in the community on their own. Yeah, while we support them behind. Yeah.
I love that. So you mentioned kids. Can you just
Mm-hmm.
briefly tell me, like, what are some of the things that you have the youth focusing on?
So for the youth, we really focus more on like building their self-confidence, training them in practical skills, such as like public speaking, communication, and help them in terms of like, their career paths, like where are they heading towards, what are some of the things they hope for in the future for themselves, and how you can see them growing in their self-confidence through the program itself, because we encourage them to be involved in programs, by doing sharing sessions, by doing facilitation work with different groups, like they facilitate kids programs, they facilitate youth programs, so that really empowers them, and it builds their self-confidence, and it shows them that, hey, I can do it, right?
Mm.
I have strengths, because for a lot of them, they have a lot of self-doubt, and they feel like they're incompetent, right? But through this program, they see that actually they can do it, and they have so much potential for growth. Yeah.
Yeah, I love that. Just absolutely showing them that, yeah, you can be a leader. You absolutely have
Yeah.
the skills to do this. So,
Yeah.
so with all of the 60 some folks
Mm-hmm.
that you guys work with, your ambassadors, I love that word.
Mm-hmm. Yeah.
Um, what has surprised you the most about how these non-professionals, right, that have gone through
Mm-hmm.
training, but these non-professionals that you guys coming alongside, training them, and supporting them, what has surprised you the most about this group of folks? Or about what
I
they can
think,
do?
yeah, I think for these ambassadors, you can see that they feel very empowered, and that they can do good work, right? That benefits the community. And return, it actually benefits themselves as well, right? And many of them find fulfillment in their role as an ambassador, and it really adds value and purpose in their lives. And I can share one example with one of the youth that I work with.
Oh,
When she first came into the program, she was really very timid, shy, wouldn't speak out much. But through our program, she actually found that, hey, she has her own strengths, right? And she grew so much in confidence in being able to speak up for herself. And today she's actually pursuing her studies in counseling. And she was inspired to do that through the program. And that is one of our success stories that we're very proud about. And we also see how it has impacted not only her, but her family as well. Because her mom is also involved in the program as an ambassador, and her mom is also doing such great work. And that is really an example of how, yeah, community members can be empowered to do so much more than even we professionals can do sometimes, right?
mhm.
And they are the ones that can, initiate programs in the community on their own. And that's the goal, right? For a long-term impact, we hope to see these ambassadors running programs on their own, obviously with our support and providing them the necessary resources that they need as well. Yeah.
Yeah. I love that. And I really appreciated what you said about, because I
Mm.
think we do see this with our advocates as well, that you get into this field or you become an advocate to help the other folks, but you end up, like you said, learning and growing yourself
Mm-hmm.
so much. And I think
Yeah,
we do that with our advocates too, that they get just as much out of it, if not more, than sometimes the children and families, right? That they're
absolutely. Yeah.
working with. And so that's what
Mm-hmm.
I love just about advocating and giving back. And
Mm-hmm. Yeah.
um, like you said, it's normal. It's normal folks, right? You don't have to be, go to school for 4 years. You don't have to be, expert in
Mm-hmm.
this area, but yet the impact and the power that advocates have, ambassadors, your ambassadors have is just, yeah,
Mm-hmm.
priceless.
Yeah.
Um, so I do want to kind of tie that to, so obviously the hope is that our CASA advocates are listening to this, right? And
Yeah.
they're not therapists, a lot of them. There's a few. We do have a few
Yeah.
that are therapists, right? But this is not the world of therapists.
Mm-hmm.
But it is about, like what you were saying, building those relationships, noticing things, supporting kids and families in ways that oftentimes the professionals don't see or can't do.
Mm-hmm.
And so I love what you were saying with that. Um, and I think you kind of already mentioned this a little bit. And so it sounds like there are a lot of similarities between what your community ambassadors are doing and what our
Mm-hmm.
volunteer advocates are doing. It sounds like it's,
Mm-hmm.
it's pretty
Yeah.
similar,
Yeah.
right? Okay.
Mm-hmm.
So you gave one example there, but what are some other small but powerful things that you're seeing that by having a trusted adult in a child or family's life, how that can impact mental health?
Mm-hmm. And yeah, I just want to say that the role of an advocate, you play such an important role, right? You play such an important role in creating safe space for kids, for families to be seen and heard. Like many times they have no one to listen to them, and an advocate like you, CASA advocates, or whoever it is, right, can be that person for them. And the relationship that you have with them is sometimes a string of hope for them. Yeah, just to be able to be seen and heard by someone, because for a lot of them, they don't have that space at all. Um, and having that connection with that one person really can bring a lot of hope to their lives. And I would say, I think there's a small powerful thing that you can do, right, to support these children and family is really your presence. Your presence matters, I would say. Just being able to stand alongside them, providing a space to be heard, like giving them helpful resources, guiding them accordingly. It really brings more support to them than you think. And sometimes that in itself is a healing factor for a lot of them. Yeah. So yeah, don't doubt your presence in their lives, because it brings so much more hope than you might think, right? Sometimes this job is not easy. I totally understand, right? And there is moments that it's gonna be tough. You're gonna doubt yourself, like, am I doing things right? Um, but when you look back and see how much these kids or families have been impacted by just your presence alone, I believe what you're doing is way more, yeah, important than you think it is. Yeah.
Yeah, I love that, Valerie. You're speaking my language. Um, Hope, right? And just people just have an innate desire to be seen and to be heard,
Yeah.
right? And this is such a complicated system as you're kind of seeing, these couple
Yeah.
weeks. And so many people in it. And so yeah, like you said, just the presence of somebody just I'm here with you, I see you, I hear
Mm.
you. Like I love what you're saying that yeah, you can't underestimate the power of just coming along coming along and coming alongside somebody. And
Yeah.
yeah, I love that. Yeah,
Mm-hmm.
absolutely. Yeah.
Mm-hmm.
So I kind of want to shift gears just a little bit.
Mm-hmm.
So I know one of the things that you kind of had mentioned, and that's kind of the point of the shared accountability and your guys's ambassadors, is all about making mental health support more accessible. I
Mm-hmm.
know we see the same problem in Montana. In the Billings area, we just don't have enough, right? And
Yeah.
so it sounds like you guys experience some of the same things in your communities. How do we make it more
Mm-hmm.
accessible?
Yeah.
What do you think, and you've mentioned a couple of these a little bit, but what do you think are some of the biggest barriers people face in
Mm-hmm.
your community as far as accessing mental health support?
Yeah. I think some of the key things that are the biggest barriers, I would say low mental health literacy. People are not very aware about what the importance of mental health is.
I
And
love
as I've mentioned earlier, stigma is still relatively high. People think that mental health is only like for people who have mental illness, right? Or they're like crazy and things like that. So people still have that perception back home in Malaysia. And also the cost of therapy is high. Um, to access therapy in Malaysia is not cheap. And even if you were to go to public clinics, the waiting list is very long, and that stops people from getting the help they need, the immediate help they need. And if they were to go to private centers, they charge exorbitant amounts, and a lot of people can't afford it, especially with the community that we work with. They are from low income backgrounds. It's very hard for them to access therapy, yeah, when they have limited resources. So I would say that is really some of the biggest barriers that makes it hard for people to access mental health support. Yeah.
I love the term you used, mental health literacy.
Yeah.
I love that. And just that stigma of, yeah, how do you change? Yeah, so what are you guys doing, I guess, to kind of change that stigma that, like, no, like,
Mm-hmm.
if we were honest, probably all of us struggle with some kind
Yeah.
of, mental, we all need
Yeah.
mental health in one way or another. But
Mm-hmm.
so how do you even go about tackling that or just changing that stigma or educating and giving them this mental health
Mm-hmm.
literacy?
Mm-hmm.
What are you guys doing in regards to that?
Yeah, I think firstly is really building a good relationship with the community first, because I think that's where we build trust with them. And when they trust us enough, then that's where we start to go into run mental health awareness programs, right? In a way that is not forcing them to, oh, come to therapy, but in a way that's easy for them to understand. So we do things like community mental health days, where it's like an outreach program where we run various booths just to educate them on what mental health is, like, oh, what you can do to help sleep better, what are some of the things you can do to help regulate your emotions whenever you feel too stressed. And then we have activities even for kids, right? That we guide them to maybe make like stress balls, like in a fun way, make stress balls, or like we teach them yeah, just different ways to regulate their emotions, manage stress, easy things that is easy for them to understand. And that is how we help bring the awareness to them that and we try to make the content relatable as well, something that's easy for them to grasp and yeah, see that actually we all go through the same thing, right? You're
Mhm.
not alone. Yeah,
Right.
so that are some of the things that we do.
I like that, just the normalizing it.
Yeah, I just know that.
And I think that's something that I know for sure in Montana, here in Wyoming, mental health stigma is tough everywhere. Just the
Mm-hmm.
idea, we see super high suicide rates
Yeah.
in Montana and in Wyoming, both for adults and for adolescents. I don't know, what it looks like in Malaysia as far as suicide
Mm-hmm.
goes, but
Mm-hmm.
I think that's something that the community is still really struggling with, even in Billings. Just, yeah, how do you reduce that stigma? How do you, especially, I would say, maybe in the adult male population that are kind
Mm-hmm.
of maybe in
Yeah.
those blue collar trades, like in mining and
Mm-hmm.
oil, and
Yeah.
like, how do you, yeah, reduce that stigma that it's okay to ask for help, that it doesn't make you less of a man or it doesn't make you weak by asking
Mm-hmm.
for help. And I think that's something that we still struggle with very much
Yeah.
too.
Mm-hmm.
And I like what you were saying though too, like how do it sounds like it's building relationship, and the only way to do that is by like being present and out in your community. And so
Yes.
being at events, holding events,
Mm-hmm.
like having that public that face out in the public
Mm-hmm.
so that you are normalizing, like, oh, it's Valerie and her group again or whatever, right? And so
Mm-hmm.
I love that, just going out, being present, getting to know your community, building those relationships so that if if and when the need, right, rises to that
Mm-hmm.
level. But I like what you were saying too, just even like making it not necessarily fun isn't the right word, but like you were saying,
Yeah.
like how do we engage you in kind of a lighter, area, but we're talking about something serious, but we don't have to make it so serious. We can talk about it,
Yeah.
doing something fun or doing something
Mm-hmm.
tactile like that.
Mm-hmm.
Um, but yeah, it's interesting, like I said, that we see the exact same thing, I think. And just the idea of asking for help. I think, a lot of the families that CASAs that we see, um, they've struggled with asking for help maybe in the past, and that's unfortunately how they ended up, in the child welfare system. But even once they are in the system, I think a lot of times people think, oh, well, why don't they just ask for help or why don't they just do that?
Mm-hmm.
But I think in reality, most of us, we struggle with asking for help.
Yeah,
Um,
we
it's,
do.
it's not as easy as we want to make it out to be. I think sometimes that there's a lot of maybe shame or
Mm-hmm.
pride or ego or just lack of
Mm-hmm.
trust, in the system from prior, and that asking for help is not as easy as we want to make
Yeah.
it seem
Yeah.
sometimes. So,
Mm-hmm.
yeah.
Mm-hmm.
I really like what you're saying too, and I don't know if you want to speak a little bit more about it, just about meeting people where they are. That's
Mm-hmm.
super important. And so maybe what does that look like when you guys do go out the community? Like do you target like specifically the lower income neighborhoods? Do you go to the
Mm-hmm.
schools? Do you go to the
Mm-hmm.
churches? Is there like a public community space? What does that look like
Mm-hmm.
as far as meeting people where they are in your community?
Yeah, so for us, we mainly work with people in the low income community. We have been building relationship with various low cost housing areas. So in Kuala Lumpur, we do have quite a number of low cost housing areas, and those are some of the communities that we mainly reach out to. We also do work with stateless children. So that's another population that we work with. So that is how we really go out to them. We go into their community to meet them at where they are at. Um, and it shows them that, hey, we are willing to come to you and that you matter, no matter your background.
Yeah.
It shows them, yeah, that, you know, hopefully it builds that trust that, we are not so scary after all.
Yeah.
Because a lot of people see, like maybe mental health therapists as like a scary thing. I mean, no one wants to see one, right?
Yeah, exactly. Yep.
So yeah, I think it's just showing them that we're all humans, that you're just like you and me.
Yeah.
So we really just go to them and not expecting them to come to us.
Yeah.
Because a lot of times we just wait, you know, we expect people to come to therapy, but we can do so much more. We can go to them and meet them at where they are at. And that, yeah, there's um, so much more impact, I feel, when we are able to just go to them and give them the opportunity to learn, to grow, and see that they actually do have so much more potential
Mhm.
than you think they have. Yeah.
Yeah, I absolutely love that. I think I that's something I wish that we did better at, right? Again, like
Mm.
you said, that we expect everybody, and when I mean we, like okay, like
Mm-hmm.
therapists, mental health,
Yeah.
like you
Mm-hmm.
expect them to go to you all the time. And we know there's
Mm-hmm.
barriers there. That's
Yeah.
hard, whether it's
Mm-hmm.
transportation or just getting the energy or the bravery, like you said, to oh my
Mm-hmm.
gosh, right, to pick up the phone and even make that appointment. And
Mm-hmm.
you're breaking down barriers by going to them. And like you said, not only normalizing yourselves, but also respecting that I'm not scared of your neighborhood and I'm not scared to come and be with, whatever, whatever stereotype, there is
Yeah.
about that neighborhood or about that particular group that you're working with, that
Mm-hmm.
they
Mm-hmm.
are humans too. And
Mm-hmm.
we're not afraid to come to your neighborhood, no
Yeah.
matter what's going on there. And I wish I could see that being super powerful. Like if they would do that in the Billings area,
Mm-hmm.
the South Side has this reputation. And instead of like telling families, oh, we don't want you to move there, or like having this negative connotation about the South Side, okay,
Mm-hmm.
mental health, like we need to be going there, like set
Yeah.
up a mental health,
Mm-hmm.
community center there on the South Side, or
Mm-hmm.
do something in a community or in the school. Or I love what you guys are doing as far as like taking it to the community and not waiting for the community to come to you.
Mm-hmm.
I absolutely love that model that you guys are doing.
Mm-hmm.
I think I love it. Love it. I wish we could do more of that, of just
Thank
going
you.
out on the
Yeah.
streets. I
Mm-hmm.
know there was briefly a moment or a time, and I think they've got rid of it, which is unfortunate, where mental health providers were going out with law enforcement. And so when law
Mm-hmm.
enforcement would get called out to certain calls, and they knew that maybe this person was struggling with some mental health stuff, they would have a
Mm-hmm.
counselor with them, right, to work and to talk down this person or to stabilize this person. And I just wish I wish we could see more the community going out and helping people rather than waiting for them to come. Because
Mm-hmm.
as you said, that it's not going to happen, right? Like
Mm-hmm.
that takes a lot of guts. It takes a lot of pushing. It
Yeah.
takes a lot of, and if you're already struggling with your self-esteem and you're already struggling with mental health, you're
Mm-hmm.
definitely not going to pick up the phone and call. If you're so depressed you can't get out of bed, how do
Yeah.
we expect this person to pick up the phone, make a phone call, or get ready, go out, go to the mental health center, right? Like, how do we do a better job of going to them? So I love that you guys are doing this model.
Mm-hmm.
Love it.
Mm-hmm.
Love it.
Thank you.
Okay, so again, for kind of our therapists, or not therapists, our
Mm-hmm.
advocates, right? Because they are not therapists.
Yep.
So
Yep.
for those of us that aren't therapists, what are a few things that we should keep in mind when we're supporting with someone, when like maybe we're working with somebody that's really struggling
Mm-hmm.
emotionally? What are
Mm-hmm.
some things that we need to keep in mind as non-trained therapists?
Mm-hmm. Mm-hmm. I would say, I think I briefly mentioned this earlier, but your presence matters more than any advice you give to them. Yeah. And just being a listening ear, like
Mhm.
telling them that I'm here for you and not necessarily giving an answer. Sometimes it's all that that person really needs, really.
Yeah,
And I would say to also listen to understand them, and not necessarily listen to respond immediately. So that is something that I would say, yeah, would be something to keep in mind when supporting
yeah,
someone.
great
And maybe
example.
it'll, yeah, be helpful to just remember like LUV, right? Love, right? To listen, to understand, and validate. Yeah, validate their feelings. Yeah.
I love that.
So
Love.
it's an easy way
Okay.
to
Okay, so
remember. Yeah.
listen. Okay, so
Listen.
listen,
Mm-hmm.
understand, you said?
Understand. Yeah,
Okay.
understand
And then
and
validate.
validate. Yeah.
Love that. Listen, understand, and validate.
Yeah.
I know for sure, like I could definitely, I need to work on everything you just said. Just being present, that you don't have to fix this, you don't have to solve
Yeah.
this, you don't have to have the answers, but just by being present, like you said,
Mm-hmm.
listening, understanding, and validating
Validating. Yeah.
is going to help so much more than you just trying to like, and that's where I struggle, right? Like I try to
Mm.
fix things. I try to like, oh, like how are we going to solve this? And I can't always do that. And so I love that. Love. I'm going to write that down.
Yeah.
Well, I think that it's just every interaction we have, right? If we could keep that
Yeah.
Keep that in mind. Love it.
Yeah.
How about like let's say advocates are out, really especially, I guess it could be kids or caregivers,
Hmm.
but anybody that they're coming into contact with, what are
Hmm.
some signs that they should really pay attention to that might indicate that this child or this caregiver or this parent might need additional support?
Hmm. Yeah, I think some signs we can look out for is definitely signs of like emotional distress, right? If you can see like something's off emotionally, or maybe like they're emotionally distant, or maybe or like they're just shutting off, right? Those could be signs that they probably need more care. Physical signs help as well, right? Physical signs such as looking disheveled or like not keeping up with hygiene can be an indicator too. So these are just some signs that could potentially help you see, maybe this requires further care or support for this person. Yeah, so I would say those are some more immediate signs that we could see. Yeah.
So,
Mm-hmm.
and what I hear you saying too, Valerie, is that like we really need to you need to know the kiddo, you need to know
Yeah.
the caregiver to know, okay, is this abnormal, right? So if they're
Mm-hmm.
typically always, like you said, put together on it and they just seem like, yeah, way different, okay, something's going on. And so
Yeah.
sounds like it's super important. Like this is not just the first time meeting them, maybe type of
Mm-hmm.
situation, but
Mm-hmm.
it's you have a relationship with them, you know what's kind of normal and maybe if something
Yeah. Yeah.
different, right? And so that's
Exactly.
where that
Yeah.
relationship is
Mm-hmm.
important. Okay.
Important. Yeah. Yeah.
Okay.
Mm-hmm.
The next question I'm not going to ask you because you already answered it. It sounds like the
Mm-hmm.
best way for advocates to show up is love. Just love them.
Yeah.
Yeah, love on them.
Yeah.
I'm going to use that. Absolutely.
Mm-hmm.
So I would love to, and you talked about this, and when I kind of said that you're speaking my language, all about
Yeah.
hope, right? Giving people
Yeah.
hope, that strength-based peace. So in your work that you do, how do you help people recognize their own strengths? Because as you
Mm-hmm.
said, so many times people just they don't give themselves enough credit for what they're
Yeah.
capable of doing,
Mm-hmm.
or from their past or whatever. So how
Yeah.
do you help people recognize their strengths?
Mm-hmm. Yeah, I think from my experience, it's really being curious about their stories, their lives, and just leaning into their stories. Because sometimes when we don't, we are not curious or open to hear them, we don't know what they're going through, right? And sometimes it's through their stories that we sort of identify that, wow, you're actually so much more resilient than you think you are, to be able to go through so much hard situations and to go through all the valleys that you have gone through, the up and downs, right? And it's through leaning into their stories that you really um see like or you identify or you recognize certain efforts that they have made towards making um better choices for themselves or healthier choices for themselves. So I would say it's really just being curious. As simple as being curious, leaning into their stories and yeah, just being open to hear what their story is like. And from there you really are able to capture, right, their strengths from those stories they share with you.
Yeah.
Yeah.
Again, you're
Mm.
speaking my language. I'm always talking about just be curious, right? Ask questions,
Yeah.
be curious. And like what you were saying, a lot of folks have a hard time identifying their own strengths. Like you're
Yeah.
so stuck in it, you forget about that, right? We always just tend to kind
Mm-hmm.
of focus on what did I not do right, or where did I
Yeah.
fail, or how am I going to fail? And I like what you're saying is that from an outside perspective, just listening to their story, you're able to pick up on those like that was amazing resilience, or yeah, what
Mm-hmm.
did you do that time, that worked so well for you? And so as kind of that outside looking in,
Mm-hmm.
you're able to highlight those things that they can't see themselves.
Yeah,
Yeah.
absolutely.
So going on then to hope, because you mentioned hope,
Mm-hmm.
I'm a big hope fan. What role does hope play in healing, or even just like mental wellness from your perspective?
Mm-hmm.
How important is hope?
I think especially for someone who is in a really hard situation or in a circumstance that feels like there's no hope at all, I believe hope is such a big factor in giving someone a glimmer of light in their dark, dark situation, right? And sometimes that hope itself is enough to give them the courage to come out of their situation or the courage to be resilient and make changes for themselves. Um, and that's what I've been seeing in my work as well, right? It's the hope that really carries people through. Because without it, I think it's tough. It's really tough. Yeah. So
Mhm.
I would say, yeah, it definitely plays a lot in our mental wellness. Even for someone, I mean like myself, right? Hope is always something you can cling on to, right? To look towards the future. And it gives you a sense of something to look forward to, right? And that really helps you to move forward instead of being stuck at where you're at or just thinking about the past. Hope
Mhm.
pulls you towards the future, towards making intentional changes for yourself.
I love that. Yep, absolutely. 100% agree, right?
Yeah.
And that's, exactly what our advocates are doing, right? Like
Mm-hmm.
coming alongside and listening, showing up, being present. And it's not only, I think, giving hope for the kids, but, in a lot of cases, it is hope for those parents. Again, like, yeah,
Yeah.
this current reality sucks, right? Like you are in
Mm.
a dark place, you are in a hard season,
Yeah.
but you're saying that hope, like your current reality does not have to be your future reality, right? That's what
Mm-hmm.
hope's about. And okay,
Yeah.
what is it going to take for you to get from here to there? And who
Yeah.
can come alongside and support you in that journey?
Mm-hmm.
Yeah, I just don't. I often say to folks, like, I don't know how people function without hope. I'm super grateful, right? And I know that
Mm-hmm.
hope comes from different places for different people, whether it's
Yeah.
faith-based or not
Mm-hmm.
faith-based. But
Mm-hmm.
yeah, like I said, so you have to remind me too. We have a whole hope curriculum I would love to share with you that we
Oh,
can
for
pass along
sure.
to you.
We'll
So
love
yes,
to
in a
hear
book I will
it.
recommend to you. But yes,
Mm-hmm.
yes. So the other thing, just want to kind of lead into systems and kind of
Mm-hmm.
that big picture thinking. And it sounds like you guys have an amazing grasp on this in your
Mm-hmm.
community. And so
Mm-hmm.
that bridging the gaps in the system, um, and actually I think actually you probably already answered a lot of this. To me, it sounds like bridging those gaps, what that looks like in practice. I feel like you already answered it. It's really going out to the communities and it's going to the people. That's what's going to
Mm-hmm.
bridge that gap.
Mm-hmm.
So I guess I'll ask my next question then. If you could change one thing about how communities support mental health, what would it be?
For me, I would say is to come from a place of curiosity
Hmm.
about any one story or even one person's story before judgment or even before whatever preconceived notions or biases that you might have about this person or a community even, right? It's
Yep.
so easy to judge a person or a book by its cover, but not really carefully leaning in into the person's story. So I would say come from a place of curiosity because that really can support communities and yeah, just mental health in general. So just be curious and listen and love. Yeah.
Yeah, I love that.
Yeah.
Um, and I think what you're saying is so important, Valerie. Like
Yeah.
we come like and I just feel like the world is just getting more and more judgy, right? Like
Yeah.
just judgmental, or like you said, just reading a book by its cover, or just making assumptions or lumping
Mhm.
everybody together that, oh, they live on that street, all those people X, right? Or
Yeah.
oh, they live on that side of the town, or they come from that town, they're all
Mm-hmm.
this, right? Like people
Mm-hmm.
are so quick to make judgments, to make assumptions, to lump everybody together, and
Mm-hmm.
you've never even taken the time to get to know that person's story. And I
Yeah.
think this is something that we always try to, coach and work with our advocates on too, is that you're going to read, in those affidavits of removal, and you got to read
Mm-hmm.
one of those. Those are written in a way that, oftentimes highlight what they're not doing well, right? And so
Right.
it's easy for us to make assumptions and judgments
Mm-hmm.
about, on for families on just reading a piece of paper. And
Mm-hmm.
I know sometimes we just really try to remind our advocates like this is a period of time. This is a snapshot in time of this family. It's meant to be written in a way that highlights the concerns. And so again, yeah, how do you go in and be curious and get to know this family on a personal level? That
Yeah.
there's so much more to this family besides what you read in this one piece of paper.
Mm-hmm.
And
Mm-hmm.
so important that you kind of part of our training. is we all have biases, and how do we
Yeah.
name them, tame them, and claim them, right? Like
Mm-hmm.
we have to keep our biases checked at the door, be aware of them, and so that they're not impacting how we show up for this family.
Yeah.
Um, and so I love that. I love that advice.
Mm-hmm.
Um, Okay, so I think I have a couple more questions for you. But
Yeah.
okay, so what encouragement would you give to everyday people like us, like our
Mm-hmm.
advocates, who want
Mm-hmm.
to make a difference, but you may feel or I feel unqualified? What is one piece of encouragement that you would give to us as like we want to make a difference, but we feel unqualified?
Yeah. I would say, just remember what you do matters, right? No matter what the world tells you, what you do really, really matters, right? There are days you may feel like you're not competent, and there are days where there might be no progress or like it's just stuck. But what you're doing really matters. Your presence, being a safe space for children and families, and being a voice for the voiceless, that in itself is yeah, really all that matters. So don't doubt yourself as an advocate and what you're doing and what CASA is doing as a whole. You're doing amazing, amazing work. So yeah, um just continue to support the work that you guys do, and I hope that yeah, CASA becomes grows, and it becomes yeah, something that everyone sees as an important value to the society as well.
Yeah. Yeah, great. Great encouragement. Yes, what you do matters. Absolutely. Okay, so I kind of have a curveball question for you,
Yeah.
Valerie, just
Yeah.
to end us up here. So, what is something like one sentence, one word, one phrase? What is something that you wish every child
Mhm.
could hear or have the opportunity to hear? So, yeah, what's one thing? What's one sentence? What's one affirmation? What would be your go-to that I wish every child could hear this?
Mm. Wow.
I know I threw
Mm.
you for a curveball.
One thing that every child should hear,
Mhm,
um, that yeah, you're a gem, you're important, no
mhm.
matter what other people might say or what other people might think. Um, you are worth it, you are valuable, and no no person can say that you're not. Yeah, I would say that. Yeah.
I love that. Yeah. And I like asking that question. It's something we actually do in my strengthening families training. And
Mm-hmm.
we do an activity where we kind of whisper that into people's ears. And it's just the power of words, right?
Yeah.
How impactful words can be, good or
Mhm.
bad, right? And
Yeah.
so just being super mindful of that, of how important our words are. And just by
Mm-hmm.
kids hearing that, that might be the only time they're ever hearing that. And that just might be the spark that they
Mm-hmm.
need to get them through or to help support their emotional well-being. Because maybe they've not heard that before. Maybe they've not heard that they're important, that they're a gem, that
Yeah.
they're important. And so, yeah, so just never underestimating the power of words that
Mm-hmm.
we take for granted, I think, all the time. And they're so, so important. So,
Yeah.
yeah, awesome.
Mm-hmm.
Okay, Miss Valerie, I that's all the questions I have. Is there anything else maybe that you would like to share that we didn't talk about that you would like to share with our advocates that I didn't cover?
I think yeah, I've mentioned pretty much everything earlier on. But yeah, just would like to say keep on doing the good work you're doing. You're doing amazing work, and I know it's not easy at all. Just from my experience observing the cases and the court sessions, but what you're doing is amazing work. So keep it up, yeah, and I'm really rooting for you guys all the way. Yeah. So yeah.
I love that. Well, thank you. Thank you for one, doing what you do too. I think it sounds like you guys are doing absolutely amazing things in your community back in Malaysia. So I love that. I think, like I said, you guys are ahead, in so many ways that I think we could definitely take some plays out of your playbook for sure. So thank you for what you do. And I
Mhm.
think it's awesome, like I said, that you got to come spend some time with us for a few weeks. You can,
Mhm.
hopefully take some things back with you too.
Yeah, yeah.
And most importantly, yeah, thank you for joining me this morning. I love, yeah, just hearing what you guys are doing, and it's super inspiring. Like I said, I just wish that we could take some of what you guys are doing and
Yeah.
emulate that back in Billings. But yeah, so
Hmm.
thank you so much. And yeah, I wish you all the best of luck when you go back to Malaysia.
Thank you so much, Carrie. I really enjoyed this
Yeah,
conversation. Yeah,
absolutely.
thank
Thanks.
you.